This year's theme is Health Innovation, Designing a Better Tomorrow. And so what we really want to do is examine the way technology aims to really deliver or help deliver and access and sustain kind of a healthy and high quality healthcare system. So now, enough talking. I would like to kind of give you a little bit of introduction of our opening keynote. It's my pleasure to welcome both Julia Novik and CJ Bawa. Julia is the founder of Canada HealthNet, and CJ is a lean coach. And in this session, they will really explore the gaps in healthcare, challenges that exist, backed by real-life case studies from hospitals and clinics. So let's all welcome Julia and CJ.
Good morning, everyone. My name is Julia Novik, and I'll give you a little bit about my background. I'm not a healthcare professional. I'm not a physician. I'm actually an accountant by training, and I'm a business professional and Shuley graduate. And about 15 years ago, I've made a change into the healthcare because I believe that coming from an outside with a different perspective, I can add value to our healthcare system. I worked across all the verticals of healthcare, started as a director of business development at McKinsey Health, and then moved on into the pharmaceutical industry. And the last 5 years, I've spent time in commercialization of innovative technologies in our healthcare system, working on personalized medicine. And that made me lead to believe that our healthcare system needs a movement. And I've started a movement with forming a company, Canada HealthNet. And you'll hear more about what that movement is. A little bit about why we're here.
Hi.
Hi.
What's your name?
Cameron.
Hi, Cameron. I'm Patch.
I have a cold. Just a bit of a cold. Is my nose red? Oh, it is.
It's red.
What's that? You don't know? I don't either. Let's find out. Taxi! Try on you. It's working very well. Mind if I sit down? Hello, my friend. Hello. Oh, look
So a little bit of entertainment, but I think the point is loud and clear. We're trying to build a patient-centered healthcare, and I want to hear from you. Put your hand up if you have an idea. What does patient-centered care mean to you? You know, when we look from all different aspects of it, as you can see here, quality, accessibility, safety, timeless. Give me some ideas. What is patient-centered care? Great. So building processes and systems all around your patient. Yeah. Yeah, so you're treating the whole person and not just that particular condition. Sorry? Respecting patient wishes, yeah. Great. Including the patient in the decision making, right? Great, that's a good one. Anything else? Any other thoughts before we move on? Yeah. So these are all wonderful, you know, we support all of them, and I'll share with you my personal experience, you know, around the healthcare. About 4 weeks ago, my father was taken by an ambulance into emergency with a 40 degrees fever, and turned out to be he had a ruptured appendix and he needed an emergency surgery. So here's the experience that we went through with him. You know, it's speaking of the attitude portion of it, you know, as a patient, you're looking for compassion and patient-centered care. From our perspective, we haven't been seen by a doctor for about 10 hours when we got there. So speaking of the patient-centered care, you know, something that we wished for, but we didn't feel it. You know, waiting times, we were told it's an emergency, but it took 16 hours before he had his surgery. 10-hour waiting for a surgeon to become available, and then 6 hours waiting for operating room to become available. And me working in healthcare for a long time and working in that particular hospital in my past life, I, of course, had to start making some noise and trying to figure out what's going on. And so I had to form a team of nurses and others to free up an operating room, which took us 6 hours to do because they had 8 rooms and they were all taken by pre-planned non-urgent surgeries. So, you know, for emergency, you had to actually make time for them to make the room available. You know, real statistics around Ontario, actually, you know, patients waiting for surgeries up from 9 weeks in 1993 to 21 weeks in 2016. So unfortunately, as you can see, this is not just my father's case, but this is what we're experiencing province-wide. Another experience that we've had was overprescribing. You know, when we were leaving the hospital, he was giving tons and tons of medications that he didn't necessarily need. He was given very heavy painkillers, which, you know, we do have a crisis with that, and that's something he didn't actually need. He was given a soft stool softener medication when he had a diarrhea the whole time in the hospital. So was certainly overprescribing. And as you know, if people don't actually understand whether they should take those medications or not, you can end up with severe adverse side effects. So in our case, luckily we didn't have it, but when you look at the examples in our healthcare system, you know, studies have been made that about $1 for every $3 is wasted drug usage, and we do have over 200,000 adverse drug reactions and fatalities as well. So with further ado, I've had lots of experiences with our healthcare system, with my sister. You know, when we speak about access to care, as you know, a lot of people still do not have primary care physicians. If you look at the statistics, it's actually very, very scary to see that such a large percentage of people, you know, anywhere between 20 to 40% of people do not have a primary care physician. This was an example of my sister. She did not have a primary care physician. She was not diagnosed with thyroid cancer, and by the time she was diagnosed, her cancer was in a very serious and very large size cancer. So those are the type of things that, certainly if we think about our system, could be avoided or reduced. So with further ado, there's many different issues that our healthcare is facing. As many of you heard, there's lots of news around opioid crisis. Statistics show that 1.9 million prescriptions, or 14% of Ontarians, 1 in 7 people are actually prescribed opioids. And as you know, it's a very addictive medication, and there's very serious side effects and issues in the society when people get addicted. So, why do these things happen? I mean, there's many reasons for it, but at the end of the day, if we're thinking about patient-centered care, it's everybody's responsibility to think about any patient that we see as somebody that, whether how you would treat this patient if this was your own mother or father, right, or sibling. So, other issues that we see around hospital visits, right? There's many hospital visits that we see all across the province for conditions that do not need to be seen in the hospital. And again, it goes back to things such as access to care. Do these people have primary care physicians? Or a lot of times what I have seen in hospitals, people come for minor elements to the emergency room because they simply don't have a physician. They don't know where else to turn. And we do see lots of emergencies crowded with those type of patients. Another big factor, which is something we hope for to reduce over time, is hospital readmissions. Again, 13.5% being readmitted within 30 days of leaving the hospital. That speaks to some root causes there. There's something that, we need to really think about. I'll give you an example of my father, actually. Post-surgery, he had a severe complication. His intestine, or he had Elias, the condition where the food and everything was just blocked and not working. And for about 12 hours, it took us 12 hours to get the doctor to actually diagnose or understand that he had the condition and he needed to be, when they put the tube in and all kinds of things to prevent it. But in his case, he developed an infection. So had we not been vocal and have it addressed right away within a matter of 48 hours within the hospital, and if he was discharged, he would be back in the hospital within a matter of a week. When we talk about the patient-centered care, everything is focused around patient, how we treat and how we, take care of them while they're in the hospital. Certainly, we can avoid some of those readmissions back into the system. So where do we stand? When we talk about all these different challenges and issues that we have faced in healthcare, this is a study was done for Commonwealth countries, 11 countries here, and you can see where Canada is placing, right? So Canada is placed last third on this list of countries. And performance, and this performance is based on quality, safety. There's some other aspects, metrics that they've been measuring here. But when you actually research and look more into why we're placed at the bottom there's some basic fundamentals that some of these countries that are at the top address in their healthcare system. So for instance, in Germany, it's one of the crucial fundamentals that they make sure is that everybody has a primary care physician. They have very low percentage of patients that do not have a primary care physician. So that makes, as you can imagine, a big difference. In my sister's case, it could have been avoiding the thyroid cancer, or at least avoiding a severe sort of stage of the thyroid cancer she was facing. So there's just some food for thought around, how we manage our healthcare system, and I think all of us being the receivers of the system, we can all make an impact, we can all make a difference. And it's a matter of how do we address it together, collaboratively, and not work in silos. So with that, in mind, after spending 15 years in healthcare and all different sides of healthcare, both on the private and public healthcare side of things, I've came up with a vision of Canada HealthNet and what I want this organization to become when it grows up. So certainly one of our vision factors is enhancing patient care. And, we want to reduce, of course, we're not doctors, but we want to make sure that inefficiencies and waste is reduced to improve the quality of care and increase the safety, patient safety. We'll go through what we found for us as a solution, or one of the solutions that could help us to achieve this vision. We want to run healthcare like a business. My background is I am a business development professional, and I look at healthcare as it's a business. It's just a business of providing care, and your customer is your patient. And so just like any business, no business would be surviving or staying alive if they did not address customer needs, right? So for every business, you need to make sure you provide the value to your customers, or your competition is going to eat you alive. And I think we need to be looking at the healthcare in the same way. And of course, we want this business of care to be operationally savvy. We want to make sure that we can treat everybody and provide them access to the right medications, to the right procedures and diagnostics that they need. And we can only achieve it if we think about how to properly optimize our system and not waste the dollars. So how to improve our healthcare system? We've come up with a model, and this model is something that CJ will further expand. But the first thing that we need to think about is we need to think about creating culture where people are valued. And what we mean by that is that right now, as I enter any healthcare facility or we work on innovation projects or any process improvement projects, the first reaction that you see from people is resistance to change and resistance to anything new and something that may take away or eat their time. And I think sometimes we just forget the reason or the meaning behind what we're trying to achieve. And so we think that with any organization, we need to make sure that you align people to the same purpose and to the same focus. And by being able to do that, you can start moving along and start making those improvements and changes that you need. You really need to think about listening to the patients. A lot of times, we run around and doing things, but we don't necessarily take into account patient view perspective, which is extremely important. And of course, you need to have the right performance measures. For any business to be able to meet customer needs, you want to make sure you measure those performance measures that are required to meet those needs. As in any business, but especially in healthcare, you want to engage your staff. Your staff are the best ones. They know where the issues are. They know what the patients need. Talk to your nurses, talk to your administrative staff, talk to physicians, talk to everyone, and you will get the answers. You will find a solution. And of course, when you have this culture of where everybody belongs and feels valued, where everybody is aligned to the same vision, to the same purpose, and everyone has a focus, and you've got the performance measures, the right performance measures in place, it becomes not a difficult task to start working on those process improvements, to create the culture, what we call culture of continuous improvements and innovation. Because without that, no innovation really is successful when you don't have the right soil and the right ingredients for it. And so with that, you're going to get the enhanced patient care or patient-centered care we all wish for. And where did I find a lot of my answers to this is through lean principles. And you'll see that guy over there who's waving at you, that's my partner, CJ, who's the lean coach. And together we've been doing a lot of projects that you're going to hear about in our healthcare system.
Good morning. Do you guys need a mic for me? Okay. I'm not as soft as her, so that's why we are good. That's why we are partners. She's soft. And she said she's from accounting. I'm not from accounting. I'm not from healthcare. I'm an automotive engineer. So you may say, what am I doing here? That's what I hear all the time. I work lots of projects in public service and in healthcare, and people say, we don't make widgets here. We don't manufacture cars. Buzz off. That's the first thing they say. But after a month, people start to see value. I just want to see hands. How many people know about lean in this room? Wow. What are we doing here? Everyone knows about lean. Do you guys know where lean comes from? From where? Lean is Toyota manufacturing system. And thank you for knowing, so it's not so hard for me to tell you. I work for Daewoo. I didn't work for Toyota. Lean is Toyota production system. Lean is manufacturing, okay? Please remember that. But I didn't work for Toyota. I work for Honda. How many people own Honda and Toyota in this room? Do you guys own Honda, Toyota? Whatever Toyota is doing, Honda has to do better. Whatever Honda is doing, Toyota has to do better. And I speak for Project Management Institute, American Society for Quality, and I was the lean consultant for City of Mississauga for 7 years, and I trained around 3,000 people, and those people were able to save around $50 million. I didn't save it. Toyota believes, train the people. People already know the problem. People already know the solution. Just engage them. $50 million. And after manufacturing, healthcare picked up on lean. I think every hospital in one way or the other has lean office, okay? And like we said, we are in all the sectors. One day we are in a collision shop. Second day we are in a manufacturing plant. Third day we are in public service. Fourth day we are in a hospital. And we apply same methodology. We do open trainings, and all these people come together into our training. And these trainings come with money-back guarantee, but out of 500 people we have trained, nobody has asked for money back. And hospital works with manufacturing plant. A manufacturing plant works with a bank. And you can apply these principles even in your home. So let's see what those principles are. That's the principle. The meaning of lean is lean. Somebody in North America loved how Toyota was manufacturing car and said it's very lean. It does mean lean meat. It means cut the fat, cut the waste, cut the bottlenecks, and do more with same resources. That's the meaning. Lean is common sense. You all know it. Every one of you in this room know it. It just goes to the back of the mind. We just want you to remember why you exist. You are there for the patient care. Anything which is not patient care, let's throw it out. That's the meaning of lean. Simple, common sense. Where did lean all start? It started with time and motion study with Frederick Taylor. Then came Henry Ford, who said, you cannot manufacture a car like this. Let's create an assembly line. Then came, how many people know about Deming? Deming cycle, PDCA, Plan, Do, Check, Act. That's what lean is based on. And then came the Japanese in 1930s and 1940s to North America. They loved what Ford was doing. They just took it to Japan. After the World War, they were forced to be lean. Why do I say forced to be lean? Why would I say that? After World War, they were forced to be lean. Lean thinking. Why?
Less resources?
No resources, no space, no money. They had to do more with the same resources. And sorry to say, I'm in North America now. I'm a citizen of Canada. Here we have abundance of everything. Big cars, big houses, big space, big money, but it all costs money, especially for businesses. So now, what has happened, lean is picked up by hospitals. The whole state of Saskatchewan, the whole state, all the offices, including healthcare, have picked up on lean almost 15 years now. We have worked on lots of projects. Of course, we are in healthcare. I was doing one project with one library. A process used to take 4 months. It's done in 1 day today. In court, a process used to take 13 days. It's done in 2 minutes. We worked in one of the case studies you will see, they have cut down their wait times by 50%. Lean is simple. Lean is common sense. The biggest problem we have seen in all the sectors is focus. We are not focused to cut. As soon as you focus like a Superman or a Supergirl on something, you can fix it. The problem is we do not focus. We are so busy doing what we do, same thing, and we are expecting different results. Just focus, and hopefully you will come to our class. We'll tell you more. There is a good news. So these are the sectors and these are the companies we are working with right now. Lean is applied everywhere. Basic principles of Lean is number 1, show respect. Respect the patient, respect the people, respect the nurse, respect the doctor, respect each other. Second principle of Lean is if you are having a problem, go live the life of the patient. So when we are working in healthcare, let's say we are going through an imaging clinic, we will register ourselves, we will change the clothes, we will go to the bed, we will see everything they do, and we will ask them how we can improve the process. If you ask people nicely, people have all the gold and all the platinum hidden, which we call problems, in their pockets. If you do not ask nicely, you're not going to get it. Lean is not about tools. Lean is about people. If you can engage people, whenever we work on projects, 70 to 80% of our time goes around people, change management, emotional intelligence. And you will learn all these things if you come to our class. Okay? Go see for yourself. Listen. Listen to the people. You may be the project manager. You could be the black belt. You could be the green belt. It's not about you. It's about them. Ask them nicely. They will tell you what the problems are. That's how we were able to cut down process time by 98%. Once you go, once you listen, once you find out waste, ask why. Nicely, people will fix the process. People will streamline whatever you want, whatever they want. But they have to be clear. One thing is very important in Lean is people think this will be a job loss program. Make sure you do communicate from the day one. Nobody will lose their jobs. How about this? Come to the event. By the end of the event, maybe 6 jobs will be gone. Who's coming to the event? No one. Please remember that. Now, there are 3 things in Lean. Very simple, basic, and I'll show you the example. First thing is value-added work. What is value-added work? Anything that the patient is willing to pay for, and they see, yes, this is why I came. Number 2 is non-value-added work, but required. This is hospital putting some processes, some checks and balances, some documentation. It doesn't add any value to my health, but you need it. Ministry of Health need it. I have to walk, I have to wait. All this is inefficiency in the process. Can you guys all remember? These are the 3 things. Please, from Monday, anything you are doing, ask yourself, are you doing value-added work? Are you doing non-value-added work right now? Or you're doing the inefficiency? How many people know the song, The Police, Every Breath You Take? Think about that song. Every step you take, think, are you adding value? Are you adding non-value added, or you're adding inefficiency? And listen to that song, please. So this is an example. Walk to the triage from the car. It's a non-value added work, but I have to walk, even if I have to walk 3 steps. Wait to be triage, waste. Inefficiency, triage, value added work. Yes, I see some value in it. This is my eyes. This is how I see your emergency process. Wait to be registered, waste. Registration, you're putting a band on me, great. So you don't give me the wrong medicine, but I don't care. I want to be seen and I want to be out. It's non-value added from my eyes. You guys can have different thought, but this is my eyes. Wait, walk, wait, walk, wait. Doctor review. I only came for this and maybe the test. That's it. Come to Brampton Civic Hospital, in the 8 hours, only 10 minutes of value-added time. That's where Lean focus is. So when I gave you the library example, 4 months to 1 day, the actual value-added time was only 1.5 hours. We still have 6.5 hours of waste in that process from Lean's eyes. Do you guys all agree with this? Again, I'm no one to tell you how to improve your process. Only you can improve the process. And I always tell this to the people, if you don't want to help yourself, even God cannot help you. Trust me, people want to change the process, they change the process. What are the 8 wastes? Defects, overproduction, waiting, non-utilized talent, transportation, inventory, motion, extra processing. Whichever sector I go into, I just change the waste according to that sector. We use the same slides. We just change the material. If I'm working in a bylaw in city of Oshawa, I change it. If I'm working in a manufacturing plant, I change it. All these 8 wastes lives in your process. It lives in your home. It lives everywhere you work. The whole philosophy of Lean is to find these 8 wastes and get them out of the process. And only do what patient sees as value added. The goal of Lean is banish downtime. So this is an example. This is one of the cardio clinic we were working with. Referral comes, booking is done, somebody prepares the chart, then there are VP pages which touches the file 3 times before the patient comes in. Then the patient comes in, then the cardio tech looks at it, then the echo tech looks at it, then again a VP nurse touches before it goes to the MD, which is your cardiologist. And then there is a checkout process. When we trained the people, look what they found. 60% of the referrals coming in had missing information or some kind of error. They had to go back to the family doctor. Cannot book appointment. The booking office cannot book the appointment because they don't have doctor schedule, technician schedule, so the booking just sits there for 1 or 2 months. Too many different protocols. There are 15 different cardiologists. Every cardiologist want to see patient this way, the other ones want to see this way, the other one want to see this way. Everyone has their own different protocols. If you would have looked at their sheet, it was almost this big to read. So many protocols. Of course, the people who are taking the booking were confused all the time, making lots of errors. What Toyota believes is, look at your process, go into the depth, find the root causes. All the errors were passed on throughout. No visual control system. I have touched the file. I don't know which file was it. So they were missing files. So lots of issues. The point I'm trying to make is, if you deep dive, if you train your people, if you ask the right question, you will get the right answer. But you have to stop. The problem is, nobody has time to stop. Everybody is driving their vehicles with square wheels. Nobody has time to change the square wheel into a round wheel. Have you seen that picture? The people pushing the cart with a square wheel. That's what I see in all the sectors. When you stop, when you focus, you will fix it. So let's hear from them. How was their journey?
Before we had the Lean operation, we've had 25 plus cardiologists in the center and practice this big that sees 40,000 plus patients. It is difficult to have a system in place where they get their testing on time and they're not lost in the shuffle, and they're also seen by the physician on time as well. So I think a system like Lean, we have been able to cut back on the time for the testing, for the wait periods between the testings, and as far as I'm concerned, I get to see the patients once all the investigations are done on time. So it has cut back my time as well. I've had a lot of feedback from the patients that say, because of this process, they're not just waiting around for a long period of time. So they get their tests done on time, and they get to see me on time. So it's worked pretty well. I would recommend this Lean program to others. Like I said, I have had the opportunity to work in a practice that was only a few physicians. You're able to get away without using the Lean program in smaller settings, but once the setting gets big, like I said, we've got multiple physicians, and in a practice like cardiology where you have to do the ECGs, the echocardiograms, the echo, many cardiologists working in the same center, you need a system in place. And I can't recommend more than just Lean, because this has worked for us. Even if we were to increase the number of physicians more than 25, if that process is in place, we should be okay. When we have patients coming in before they see me, they are supposed to have their information input in the system, they're signed in, they get their investigations done like the ECG, the echocardiograms, the treadmill, stress echo, if needed, and then after that, they're seen by the nurse practitioners to get the appropriate history before they see me. So this flow, we've noticed that the time between these investigations have cut down. From multiple aspects, this has improved my practice because I am able to see the patients more efficiently, and if there is extra time and I'm not waiting for the patients, I'm able to spend that time discussing the disease process with the patient themselves. So time management is the key here. If I can save time between the investigations or in this process from the time they walk into the door, I'm able to spend more time with them. And the key is that.
So you will have a chance to meet the owner and the chief cardiologist at 12 o'clock. Yariv Kaiken, he will be here. So you guys can talk. So again, is it difficult? You know what I want you guys to think? Some days, just feel like you don't even exist in the organization, become a ghost, and live the journey of the patient. See from a different eyes. Don't work that day. Just watch the flow, just stand, or put a camera and just see. I'm not asking you to put the camera and tell people, hey, you were doing this. Just watch the flow. Just stop and think. You will find out whatever is wrong in your process. But again, the problem is people think continuous improvement is a job, it's a different task. And Toyota doesn't believe that. I'm a manufacturing engineer. I'm a Sikh by religion. I used to wear a turban. I used to have a beard. In India, 47 degrees Celsius temperature, 95% humidity. I used to run around, and I used to fix the line while the line was running. That's what Toyota believes. Nobody's coming to your help. You need to get your own training. You need to do your own problem solving while the action is happening. We don't have time. We don't have money. We already are having tough times in healthcare. So take the training, take yourself to the next level, and fix the problems. Virginia Mason, they created an alert system. The biggest problem in healthcare is the safety defects. They started reporting safety defects from 3 to 222 per month. Toyota believes if you do not know about something, how are you going to fix it? If you only know about 3 issues, you're only going to fix 3 problems or 3 solutions. But the staff members started coming out with all kinds of problems. 222 safety incidents from 3. Now you can start analyzing and start fixing the root cause. $11 million in cost savings, $1 million in inventory reduction, and they improved the whole flow by going to Toyota Japan and looking at how they get the parts fast, and they've worked it on the patient care. Patient in and patient out faster with new layouts. So Robin Williams is talking to you from heaven.
Mr. Adams, and cultivate friendships with those amazing people standing in the back of the room. Nurses that can teach you. They have been with people every day. They wade through blood and shit. They have a wealth of knowledge to share with you. And so do the professors you respect. The ones who are not dead from the heart up. Share their compassion. Let that be contagious.
Mr. Adams, I demand that you turn and address the board.
Sir, I want to be a doctor with all my heart. I wanted to become a doctor so I could serve others. And because of that, I've lost everything. But I've also gained everything. I've shared the lives of patients and staff members at the hospital. I've laughed with them. I've cried with them. This is what I want to do with my life. And as God is my witness, no matter what your decision today, sir, I will still become the best damn doctor the world has ever seen. Now, you have the ability to prevent me from graduating. You can keep me from getting the title and the white coat. But you can't control my spirit, gentlemen. You can't keep me from learning. You can't keep me from studying. So you have a choice. You can have me as a professional colleague, passionate, or you can have me as an outspoken outsider, still adamant. Either way, I'll probably still be viewed as a thorn. But I promise you one thing. I am a thorn that will not go away.
Is that all?
I hope not, sir.
Guys, listen. Listen to the patient. Listen to the nurses. Listen to the stakeholders. I don't know anything about healthcare, and I don't need to. You need to know. The people in the process need to know. Just listen. You will get whatever you're looking for. Back to you.
So we're at the end of our journey here, but the point we're trying to make is that we know that the world is moving fast, and we cannot do it, of course, without technology. And as you know, many of you are here because the whole focus of this conference is, around technology, entrepreneurship, and sustainability. But the point we're trying to make is that you need to first identify, the right needs, what needs you have in order to address them with technology. As you can see here, we're still in a hospital setting where a lot of things are manual. 72% of full-time employees still using scanning things as an example. Physicians take 2/3 of their time on paperwork and administrative staff instead of taking all that time with the patients. So we have a long way to go, and we believe that technology is key, but in order to get to the technology, in order to make it successful and get the right technologies in place, we need to embrace the culture of lean, the culture of continuous process improvements, so that everyone at every level of healthcare organization can look out and think about those things in order to bring them up, in order for us to identify and know what problems we have and what technologies we need. Yeah, so the last part of it is the patient is being bouncing from clinic to clinics. Yeah, so so it is a challenge, right? Because as we talked about, it's very siloed, and the only way that we're going to address it, and I mean, we bring that up, but it has to be addressed at the system level, is a multidisciplinary team approach, right? So, I know in the hospital setting, sometimes it's a little bit easier to do, but when their patient is in the outpatient clinic, what we have done when we do lean projects, we look at the referral processes, we look at the coordination of those processes in order to make sure that, they think from perspective of a patient, when the patient needs to be taken and referred to another specialist, how do they make sure that happens correctly and that happens efficiently and it doesn't get lost somewhere in the shuffle, right? That particular referral as an example. But it is something that requires lean thinking at every single specialist office. So it is a big job and does require Ministry of Health support.
And that means it could be a process review from their end. Sometimes you can only do process review, whatever your power is. Maybe Ministry of Health. You guys have to push Ministry of Health, let's do a process review from the top end. You can only focus what your power is. But it's possible. Anything is possible. When Toyota improves the process, it improves from the time steel is manufactured to the time car is delivered. You can pick up here, but really if you want to fix the problem, you have to fix start to finish.
What's the end goal? Like, when are you finished? So you increase efficiency, you increase patient-centered care, but when are we done?
Infinity. Never. Never. There is no end. There will be no end. Toyota believes. Toyota never says that we are lean. They still have issues. So it's an endless journey till you become 85 and you're still working in healthcare. You'll be still improving the process. Toyota and Honda has 100 plants across the world. Every plant makes 1,000 improvement a day. It's an endless journey. There will be no stoppage because you will always have issues. The whole philosophy is, are you removing the waste like you remove the waste from your home? Otherwise it smells or it gets maggots. You have to remove waste every day. Can you stop removing waste from your home? It's a continuous cycle.
My name is Luce and I work as a project manager of process improvement at Singh. And like Sidhu is saying, is the hospital has been in this journey with me for 5 years. And it has been proven to be effective, and that's why we continue to do it. However, we have about 10,000 employees, and we haven't even finished to deploy Lean completely in all the areas, from research to our foundation and everything. The new challenges keep coming. We're receiving an increased number of patients that before we didn't have before, and also the acuity of the patient is changing. And now we're adding a new
facility.
Patient record system that we're implementing across the hospital, so new challenges are going to continue to come, and I think Lean is an excellent tool to help with those projects, and as well as just continue addressing and facing all the challenges that you will continue to have regardless.
As you heard Dr. Newry in the video there, PACE cardiologist said, when I worked in a smaller setting with a few physicians, we could get away without any system, just figuring stuff out. But as we get bigger, and now we have 20 cardiologists and 50 staff, it's impossible to run a lean or efficient operation and provide patient care without a system. So
we keep on adding. What's the North American thinking? Sorry, I'm on North American also now, is throw people at the problems. Oh, there are people, lots of people scanning. Hire 3 more people for scanning. Where the answer should be, why are we scanning? Why? It starts with why.